iris and stain. So just a tiny segment of the orthodontic part. So at least, you know, the good things about my background on the lingual braces is I used to do the thesis, master thesis back in St. Louis University in 2000, you know. I did the study of the alloy, you know. And at that time, I studied on the friction of the low nickel bracket and wire things. That's why I'm so used to the metallurgy, the alloy, the magnetic phase, the austenitic phase, and transformation in temperature. I think all of you that doing diamond braces, you not be surprised to see the super smart wire, right? That you squeeze the wire, and once when you put in the hot water, it just jump back into the, spring back to the original configuration, right? So be not surprised with the how smart that you can do with the wire, with the alloy, you know, the nickel titanium wire. But the once that kind of, you know, surprised me that how Dr. Mehdi can put all the artificial intelligence and put everything in the wire, or like an octopus like. Last night we had like a speaker dinners, you know, and one of the questions that I asked Dr. Mehdi that, why you use the logo of the Brava? Because I got confused, you know, because Mia, when she introduced, she always say Brius, Brius, right? So actually Brius is like the name of the company, and the product is Brava. And Dr. Mehdi, you say Brava, is like in Italian, like when you say bravo, right? It's like to celebrate. And Brava is the similar things, right? And also he shows the octopus to be the symbol of Brava because of the, you know that octopus is like among the smartest animal on the planet, you know, beside the mammal, and without having to think that much in the brain, right? Because all the nerve in all its tentacles is so smart because they have all memory. Octopus can do a lot of things very smartly. If you watch National Geographic, you're gonna see that they can camouflage, and how they prey, and how they change the color, and how they escape, and how they hide, right? A lot of things. So this thing very similar to the symbol of octopus, really. So let's have a look at my case, you know. Everyone, when you see this case, this is certainly not a good case to start with, you know. But I simply cannot find the case to start with, because first thing that you might want to know that how much it is, right? And the price of it is like a double of the Invisalign. So the first thing that kind of, where I gonna find the patients, right? So luckily, this is my own granddaughter. They are twins, you know, but they are not identical twins. They are fraternal twins, like the alike twins, you know. So basically, they are sisters, but share the same birthday. But one is so pretty, but this one is like of the lesser god a little bit. So I kind of have a heart for her, you know. I saw her still very young, you know, but she got like every time she talked, like the tongue keep pushing, but asymmetrically. Seems very young. So I told her, Mom, you know, you should need attention a little bit. Maybe go to find some speech therapist, or maybe have the early intervention, you know, at the mixed dentition thing, you know. But then suddenly, I think it's maybe that God gave me this case to start with the Brius, because it's my own granddaughter, you know. And luckily that, you know, the parents willing to pay for the fees of the things. I didn't charge anything because this is my granddaughter. No. You know, this problem is so difficult because you can see this skeletal problem. Skeletal class 3 is very hard, and the child is still growing, right? And at the time that I start this case, she just got the period for 4 months already. That means her upper arch start to fuse a little bit because the suture, right? Mid part of the suture start to get interdigitated a little bit. So if you think orthodontically, you would want to do what? Because look at the problem list, right? Canting, spacing, posterior crossbite and open bite, basically on one side, on the left side, maxillary constriction, asymmetrical tongue thrusting, occlusal canting, the upper down to the right, lower down to the left. So this is the clinical situation in the mouth. The patient is 13 years, 7 months, have period, so it's 4 months of menarche already. But the parents, okay, I know that maybe that we have to just do a long treatment, and when the patient finish the growth, that maybe at the 17, 18, we might do it again. I accept that. That's fine by me. Okay, at least they know the nature of class 3 problem. So options for treatment for this one is like, maybe some of you might be no any treatment now, right? So wait until you finish the growth and do it one time and do surgical things. Or try, because now at the end of like a maxillary growth already, because it's almost 14 years old, right? So we should try our best in expand the top, right? You can use the bone assistance or bone anchorage maxillary expander. You can do the reverse pull head ear. You can use the tongue training, blah, 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 a lot of things if you think orthodontically. But when I brought this case to Dr. Naranda, that it is okay that I'm gonna try this one with Brius, he said yes. So I got confident a little bit, so let's try it. So Dr. Mehdi, what do you say? So this is a bit challenging a little bit, right? But it's possible. But from your lecture, at least, I'm relieved because Brius is like a good expander, right? And look at the twins, you see, that's why I have a heart for this one, because they are twins, but fraternal twins. One is kind of pretty and normal occlusion, very mild frowning, doesn't need any attention now. But the other one, you see the mandible start to screw to the left a little bit because the tongue and the growth as well. Look at the other twin, right? Pretty lovely, very mild frowning. So parents don't bother to get any treatment for her yet, but maybe do it one time when at the late teens. So this is how you start with the Brava placement, or you need to have a chair side. You should have the micro etcher or the sandblaster too, and I'm gonna show some sequence a little bit. Of course, you should have the lingual wide guard. You should have the bracket opener, and you should use the transbone. And with the new brackets, because right now the brackets of Brava have been improved to, this is the second generation already, right? So it's custom fit and better contour to the palatal surface of the tooth. So you should use the transbone low viscosity, LV transbone, LV. I'm gonna show you the list, okay? So this is the two things that you must buy, The lingual wide guard, prefer Henry Schein, second choice, 3M. And the bracket opener by Forrester Dent. And this is the glue or adhesive. The soft flow you can use, you may use or may not. It depends after you put everything on. If you're afraid that it's gonna abrade the patient's soft tissue, you just put the soft flow a little bit, right? You see the transbone, they have the transbone Supreme LV, the low viscosity orthodontic adhesive. That's ideal for the current brackets. But if you use the older version brackets, you have to use like Transbond Plus, right? With a thicker a little bit. Basically, you start with the tooth preparation, like Dr. Naran, in the Dr. Naran slide, he showed the Nola system, right? The dye field system. It is good. If you have Nolan, then you can go on the whole arch, right? But I used to use Nola, but that almost 20 years ago, since my residency, and I lost it, so I didn't buy it. So I'm gonna show you my technique. So I just cut the tray a little bit and do it, very easy to handle with the moisture. And you should micro etch the two surfaces on the palatal side as well to increase the bond strength, okay, and etch. And then you put the composite, or the adhesive onto the back bracket pad, don't put too much, and you have to clear the excess with the micro brush. And then press the indirect bonding tray firmly over the dentition. This step is very, very important because, like Dr. Naran said, the first visit you have to just do it right and do it great. Otherwise, if you just everything all the AI already pre-calculate for you, but if you miss some little thing in the bonding, like you bond maybe half a millimeter chip a little bit, it's not gonna come out exactly like what you see in the computers, right? If you have the broken bracket, right, what you're gonna do? You can reuse it if your patient still keep it, and then you just take the old adhesive out and sandblast it, micro etch, and just put it. That's why you have to still keep the template. And you can put, but you have to cut it, and just put it in the cheek again and rebond it one by one. I got the question from the audience a little bit, so I can answer the Medi a little bit in case that our patients study abroad and they left, they study in London, and then suddenly things come off and they lost bracket. What should we do?
So you mean like they
lost the Brius bracket?
Okay, so if they go to the clinic that has access to Brava, they can use an inventory bracket that is flat.
That is flat.
Okay, and then that flat bracket can be used with the digital bonding tray. The same digital bonding tray that can be used for custom bracket can also be used with flat bracket. The only difference, actually, you mentioned that instead of Transbond LV, low viscosity,
you have to use Transbond
Plus that has higher viscosity. Why? Because the surface of the tooth is not flat like the bracket, so you customize it with the higher viscosity composite.
Okay. And do you recommend any particular brand of the bracket, the flat bracket?
Actually, if you request, we can send some inventory flat bracket to you that you don't have to purchase it from anywhere. So we can send flat brackets to you.
Oh, okay.
Yes.
But if this accident happening with patient abroad, while studying abroad or what,
right?
They go to the dentist and now it's not available in Europe yet, right?
That is true. So in the future, it's gonna be much easier. You can find a Brius provider. That's gonna be easier. But for now, that doctor needs the digital bonding tray because we cannot just bond it anywhere. So you need the template for that patient, and they need the flat brackets.
Or maybe let them find the clinic first, and then we might have to send the template to the doctor.
Yeah, so that's. But you have to do a little bit of training how to repair the tooth. But in the future, I'm sure when there's gonna be more Brius providers, it's gonna be easier.
More international.
France, in England, for example, and then they will take care of it for you.
Okay. Yeah. Good. So because I didn't use the Nola because I lost it. So this is the way I do it. I use this, you see the soft diamond disc, to cut it in 3 segments. As you see that the indirect bonding tray, the whole arch, I cut in 3 sections. The front part 3 to 3, and the posterior right, posterior left, and you just do the lip retractor like that, and you just can control the moisture more easily with the short segment. And if you guys order the product, inside everyone you get this information, okay? So if you want to take some photo, you better take from this one. I just magnified it for you. You're gonna see that the new bracket have the new clip design. With the new clip design, they're gonna have the stopper. So when you use the bracket opener, you're not gonna open it because they have the stopper, like to secure it, And when you engage the